Hello ladies and gentlemen, my name is Brad Boyd. I'm a Republican running for Williamson County Coroner. Today's video I'm going to talk about my nurse career and how it has uniquely prepared me to fulfill the second main duty of the county coroner, which is to name a medical cause of death. Retired from the police department in 2008 and became a registered nurse in 2009. Received an associate's degree at John A. Logan College. Shortly thereafter, I was hired as an intensive care unit nurse. It's a very challenging position for a new nurse. However, with assistance of some great mentors and coworkers, I eventually became a relatively competent intensive care unit nurse. And in that role as an intensive care unit nurse, which I worked for 7 years in that role, became very knowledgeable about medical conditions that we took care of there. Nurses specialize. I'm sure people have seen nurses at their doctor's office. You've seen nurses in emergency rooms. We have nurses in operating rooms. We have nurses in intensive care units. We have them in nursing homes. And the nurse in each role obtains a specialized knowledge needed for that unit or that role that they're fulfilling. And being an intensive care unit nurse, I took care of a lot of sick people, critically sick. We took care at the intensive care unit I worked. We had open heart surgeries, we had brain surgeries, we had surgery complications from surgeries, we had medical conditions that lead to death, cancer, COPD exacerbations, septic shock. These are all things that people become critically ill from and a lot of people die from. And in doing that job, I developed a knowledge base and expertise relating to those illnesses and conditions that lead to death. And would consider myself an expert on the common causes of death that we took care of there in the intensive care unit unit. And you say, well, you're just a nurse, Brad. How knowledgeable can you be about these medical conditions that lead to death? And I would argue that nurses spend 12 hours a day taking care of these folks. And in that role, you cannot help but become knowledgeable about the presentation, the treatment, and the progression of these disease processes, and develop a specialized knowledge about them. And so that level of knowledge and expertise has uniquely prepared me to be able to review reports, review medical records, and to have an understanding of any autopsy reports or medical reports that the coroner uses to help make that determination. During my nurse career, I obtained a Bachelor of Science degree in nursing from Murray State. I started a Doctor of Nurse Practice program, graduate level program, where I successfully completed several classes, including advanced pathophys, some theory. I was diagnosed with cancer shortly after I started and had to withdraw because of the treatments. Been in remission now for 5 years, knock on wood that it continues. But so anyway, that's my career in nursing. After 7 years, I moved to the emergency department, where I've been since that time. Obviously, in the emergency department, we're all familiar with what an emergency room nurse does. We acutely ill or injured people that we deal with, cardiac arrest, traumas, the various disease processes that bring people into the intensive care unit. And so anyway, my nurse experience combined with my nurse experience in education combined with my law enforcement experiences uniquely prepared me for this position. And I would encourage you to vote November 3rd. I would appreciate you if you vote for me. Also, early voting has started, so please vote. Thank you.